On the same day our government banned crowds of more than 500 people, 70,000 Brits crammed together for the Cheltenham Festival.
Henderson Chio giving chase to those. Edwardstone's moved into sixth.
Hours before, the UK government said this.
We are considering the question of banning major public events such as sporting fixtures. And the scientific advice, as we've said over the last couple of weeks, is that this banning such events will have little effect on the spread.
Cheltenham's local health authority has now recorded 181 coronavirus-related fatalities, more than all deaths in Australia and roughly double the number in surrounding English regions. And it's a damning example of the UK's costly mistakes in the fight against COVID-19.
Together we are tackling this disease, and I want to reassure you that if we remain united and resolute, then we will overcome it.
The old British idiom of keeping a stiff upper lip just can't cut it in this crisis, with reports of the UK's true coronavirus death toll sobering the nation.
Research by the Office of National Statistics suggesting the actual death toll in England and Wales in early April was 40% higher than the number reported by Downing Street.
Their government was selectively framing figures, whether to keep citizens calm and carrying on, or to keep their own jobs. Statistics weren't portraying the true tragedies unfolding across the country.
Those daily government figures don't include deaths outside hospital, in care homes, hospices, or in the community.
So these are deaths across the UK from all settings, so including in care homes as well. It doesn't look like that much of a difference, does it? But actually, it represents a 28% undercount. Even these supposedly most authoritative numbers might be undercounting COVID-19 deaths, or something else is going on.
Unlike the Australian government, the British government initially discussed a policy of herd immunity, whereby a large proportion of the population needs to catch the virus and hopefully become immune to it.
We want to suppress it, not get rid of it completely, which you can't do anyway, not suppress it so we get the second peak, and also allow enough of us who are going to get mild illness to become immune to this, to help with the sort of whole population response, which would protect everybody.
Concerns have also been raised over lack of policy. Airline passengers are continuing to enter the United Kingdom without any health checks, as airport bosses plead with the government for new measures.
We have the CEO of Heathrow Airport himself, who has written to Matt Hancock to question why his hub airport has been left totally exposed to any incoming arrivals. Today, I can still very much fly a day trip to Iran, for example, one of the countries that has been ravaged by coronavirus, and walk in straight onto the tube, straight into the supermarket, and even back to work.
The government's attempt to justify that by denying London's similarity to Tokyo or Sydney as a major travel hub.
First of all, we are not similar to many of those other countries. I think we should be very clear about that, just in terms of traveller and passenger flows.
The only current measure in place for incoming visitors to the UK is to self-isolate, although this is not tracked or enforced.
There's a pattern emerging here. We were slow into lockdown, slow on testing, slow on protective equipment, and now slow to take up these offers from British firms.
While the British people have been doing their utmost to stay home and support their NHS, slow response from the government has driven more towards it.
It's so tight, you've got somebody sitting on your chest and you're trying to breathe and you're not getting anywhere. It's really frightening.